Dr. Colby, thank you so much for meeting with us today.
It's a pleasure.
You had a presentation at AAO 2016 called The Bump That Stumped Me. Interesting name. Can you tell us a little bit about your presentation?
Absolutely. You have to credit the program directors for coming up with that title. But basically what they wanted me to show was a case of an ocular surface tumor where I was fooled by the diagnosis, or fooled originally by the presentation of the lesion and what it ended up being.
Sure. So what was the original diagnosis that you thought, and what was the...
Well, so a young woman came into my office with a non-pigmented or amelanotic lesion of the cornea and conjunctiva, and it looked clinically like an ocular surface squamous neoplasia. So we, after discussing the various options with her, she elected to proceed with a trial of topical chemotherapy, which we did for about a month, and she came back in having had no issues with the tolerability of the topical chemotherapy, but unfortunately the lesion had grown on the agent and also had developed pigment, which led me to conclude that it was not a squamous cell tumor, but in fact a melanocytic tumor. And I took her to the operating room the next day and removed it, and it was indeed a melanoma.
What can clinicians take away from an experience like that for their own practice?
So there's a couple of things. First of all, amelanotic lesions can be very challenging to diagnose. The vast majority of them are going to be squamous lesions, which respond quite nicely to topical interferon, but melanocytic lesions do not respond to that particular type of chemotherapy. And so when you elect to treat someone with a chemotherapy agent without a tissue diagnosis, which there are compelling reasons to do that, you have to understand that the agent may or may not work. And so it's important to keep the diagnosis of amelanotic melanoma in mind, and also have a thorough informed consent with your patient regarding the pros and cons. So we could do surgery on everyone, remove them and apply cryotherapy, but there are surgical risks. So there are some lesions that respond quite nicely to chemotherapy, but this did not happen to be one of them.